This is Dr. Yassine, our Medical Director of Infection Prevention, and I'm Amy Metzger, an infection preventionist, and we're here to demonstrate our endoscopy culturing process. So what we have as far as supplies lined up is we've got 60 cc syringes that we will be filling with 60 mLs of sterile saline that we're going to use to flush the lumen of the scope with. We've got conical tubes filled with 5 cc's of the sterile saline, and you'll notice that these are all numbered because we're going to correlate the number of the tube with the serial number of the scope. So that's very important to keep track of that information so that when we send the specimens to the microbiology lab, we can correlate which scope goes with which specimen. We've got sterile wire cutting scissors that we're going to keep sterile. We have endoscopy coiled brushes that we will use that are sterile, and we specifically use the smaller end of the brush, but you can use the larger brush if you have a channel that you, or a port that you want to do further scrubbing with. So, and then this we have set up on a sterile field. Dr. Yassine and I are masked to prevent any respiratory contamination as we're working over the sterile field. It's not completely sterile, but it's very clean. So, okay, so now we're on specimen number 5. We've got, it helps to uncap things and loosen them ahead of time. So we're on this particular scope, number 5, and we've already checked the serial number to correlate with this 5 specimen number. Dr. Yassine is going to flush half of the 60 cc syringe sterile saline, and I'm capturing the diluent into this sterile cup. So the basic is flush, brush, flush. So we just did our first flush. Now we're going to take our endoscopy brush, keeping it sterile, uncoiling it if possible. It helps to feed through the lumen of the scope if it's not twisted.
So this is the biopsy channel. We usually just brush it a couple of times. And this is the anti-grade
and I'm gonna
brushing through the lumen.
I'm gonna hold the lumen over and capture any saline that's pushed out through the brushing, because that's where likely there are particles or bacteria that we, could capture. And you push that brush through until the brush comes out the other end. And now Dr. Yassine is withdrawing the brush, keeping the scope tip sterile. Giving an extra little scrub to that lumen.
It's retrograde.
And now I'm going to snip that tip off into the sterile saline. You see that, Brandon?
I can.
Okay. It's important to insert the brush down into the tube because if you're not careful, it can fly off and then you've lost your specimen. So if you can snip it off down close to the inside the tube, it will help prevent losing your specimen. So we've done our brush. Now we're going to do our second flush with the rest of the 30 cc's remaining.
I'm done.
Okay, so we've got our sterile specimen, and that's it.
Thank you.
Okay. And Dr. Yassine, do you want to talk about these other brushes that you have here?
Yeah, these smaller brushes are used specifically to brush the elevator channel for some of the ERCP in the US. You can see it's a finer, smaller brush, and we typically use it for brushing above the elevator channel where it's hard. So we move the elevator channel up and down to make sure the blade is movable, and we brush carefully with this brush, and we cut it in the same fashion as we cut the other brushes to make sure we recapture that. There's no need for that in this particular scope, but for ERCP and EUS, you may need to do that.
Okay. Thank you.